So, like I said, we're going to play a game. I give you the medication, and you're supposed to tell me one thing about it, not a bunch of it. Whatever you think is the most important. That is what your board is going to ask you. One question and one answer. Don't pick a bunch of answers, just one answer. That's all. I give you Clozapine, and you give me one answer. Don't give me more than one. Whatever first thing that comes to your mind, because that's what your board priority side effect. So what do you think? So one answer choice. Clozapine. What side effect you think is the priority side effect of that medication? What do you guys think? So I see agranulocytosis. So that's excellent. You guys got it. Congratulations. How about this? If you can see it, I'll give you this. That's the same thing. What is the number one side effect? First, you have to know what is used for, and then what do you think your board will ask you about it? So you get number one. Excellent. Congratulations. Now, number two, Propylthiouracil, PTU. What should come to your mind? One biggest side effect. I know it's used for thyroid problem, but what is the biggest side effect of the? It's used for thyroid problem, right? It will not cause your fever to go up because it suppresses thyroid hormone. So it's not going to cause you to have fever. What do you guys think? What was the answer for this? It's the same as this answer. So what do you think? Agranulocytosis. It's number one for PTU. So agranulocytosis is number one side effect. So agranulocytosis is the side effect number one for both of them. So clozapine have the same side effect. So just pay attention to that as much as possible. So agranulocytosis. So don't forget that. Like I said, priority side effect, right? Do you remember this medication? What do you think? When your board asks you, what are they asking you to do about this medication? Most likely, patient is taking this and they will call the clinic and they will be screaming, hey, this is what is happening to me. And you tell them this is normal. So if I give you Niacin, what do you think? You'll be calling the clinic to tell me that this is what is going on with you. I'm on the NCLEX. What do you think? Niacin. What is the number one side effect? So today is pharmacology. Farm on the NCLEX. I just want to know how much farm you guys know. If you need help, check adapt NCLEX on demand. High yield facts, right? On the farm. But what is niacin? What do you think? The answer. I like that. Number one side effect is flushing, facial flushing, which is an expected finding. And it's the number one complaint. The patient will call you and say, hey, this is what is happening to me. And therefore, you tell them, it's okay, don't worry, right? So let me make it easy now. This one, there's a bunch of side effects. Okay, this is the bunch of side effects. It depends on this situation. Okay, the number one side effect is not common. The priority side effect is not common. There's another priority side effect that is more common. So you can give me both. I will take it. So there's two priority side effects. One is very common, and one is on. It's not that too common. The most common one is not the major one, right? So, so what do you think? Enalapril. So I see angioedema. This is the number one, but it's not that common. I mean, we worry about it, but it's not that common. What is the most common? The second that is the most common. So hyperkalemia. If you say cough, fine, I'll give it to you. Nagging cough. This is like nagging cough. It's okay. But these are side effects you have to know for this medication. How about this? Oh, Escitalopram. What do you think? I'm teasing you guys, trying to see how much pharmacology you know. You see, I throw the medication away. If you master it already, you recognize the medication, and then you said, "Oh, I know this. This is the number one side effect I should worry about." My boys are good. I like it. I like it. No, it's not central nervous system depressant. Um, it's sexual dysfunction. So sexual dysfunction. This is the number one side effect of this medication. So sexual dysfunction. I like that. Serotonin syndrome is the number one side effect. Serotonin syndrome is when you combine it with something else. So sexual dysfunction is number one side effect of that medication. Okay. Sexual dysfunction is number one. Okay. How about that one? If you give me two, I will take it. But there's a common side effect associated with this medication. Phenytoin. What do you think? If you see that, what do you think? You see it in your boards and then you choose it, and then that's not the priority. It's used to treat seizures, but that's not the side effect. It does not cause coma, phenotype toxicity. But what is the number? Ataxia is not the number one. Gum swelling. What is the another name for gum swelling? What is another word? Gingival hyperplasia. Excellent. And this is due to when you have a dose greater than 500 milligram. All you need to do is good oral hygiene and an antibiotic, and that will take care of the problem. So that's number one side effect. Gingival hyperplasia, very, very common in these people when they take this medication. Okay. So when you're reading this, just make sure that's the things you worry about. Of course, you have to know the other side effect, but you have to worry about this one. When they said, what is the next priority function? I'm picking that answer. Visit the dentist. I like it. Good oral hygiene and antibiotic. Now, I give you carbamazepine. What do you think is the number one side effect of that medication? Or your priority side effect? What should you worry about? Right? What do you think? The side effect for this medication? Agranulocytosis. I like that. I like that. So it's the same thing as that. Okay, so we have a bunch of agranulocytosis, you see, on the board, right? Excellent. How about this? How about this? Let's see. I think I will give you that. If you give me more than one, it's fine. But what do you think? Methotrexate. What is the number one side effect now you should worry about? And then don't get confused with this. Okay, don't get confused with because that's what they will confuse you with. Carbamazepine and that. So don't get confused with that. So that one and that one. Don't get confused with that. No liver, no nephrotoxicity. Immunosuppression, good. I mean, that's good. But that is what is used for. So, but that's not what you should worry about. It's designed to immune suppress your immune system. So that's what I give you for bone marrow suppression. Those are the things I expect, right? It's supposed to do that. But the biggest side effect, um, because I give it to you to um, basically suppress your immune system. So I expect that. But this is the problem: liver toxicity. Okay, so liver toxicity. So hepatic injury. Okay, how about this? This one too is designed to suppress your immune system. Both of them causes infection, right? They are immunosuppressant. This one attack your liver. How about hydroxychloroquine? What do you think? What about hydroxychloroquine? I'm just giving you what you see in your test when you practice questions. These are the priority side effects you should be picking. Once again, both of them will lead to infection because but that's what they do. They suppress your immune system. Who know hydroxychloroquine? It's excellent. I get the answer right there. I, I get the answer. I'm not going to mention the name, but I get it. See, I got it. Retinal damage. So that's the key aspect of it. Retinopathy. So I would say retinopathy. So your retina, you got to see the ophthalmologist to make sure you're getting your retina taken care of. But that's the difference between methotrexate and hydroxychloroquine. And so when I give it to you, I'm worried about. I know I'm going to surprise your immune system, but these are the things that your board will ask you. What else should the nurse worry about? Liver toxicity and then retinopathy. And you guys are acing the test. I don't even have to do this anymore. I mean, you guys master it, right? Excellent. Excellent as much as possible. Um, so I like the answers. How about this? HCTZ. So hydrochlorothiazide, right? Yes. Low potassium, hypokalemia. Excellent. So far you acing the test. So excellent. How about it? Let me make you a little bit harder. If I give you this, what should you worry about? If I number one thing. If they say choose one thing, and one only, what should you worry about? And this guy and this guy. So you have two options. So not hyperkalemia. Let me see. Hypotension. No, that's not number one. That's not number one. Yeah, it slows down the heart rate, right? Yeah, it's called beta blocker, right? I mean, amiodarone, not a lung function test. You got to say it. Pulmonary fibrosis, yes. So pulmonary fibrosis. This is pulmonary fibrosis. How about the beta blocker? What should I worry about? I know, I mean, everybody will pick that answer, right? Hypertension, right? But there's two that that's what I care about. I don't care about hypertension or dropping your heart rate. And you know what I care about? Asthma exacerbation. Asthma exacerbation. And what do you guys think is the second one? Asthma is when your board asks you about this, they most likely asking you about somebody who's not supposed to, he has asthma because he's a non-selective beta blocker. These are some of the critical thinking questions. You know, you see propranolol when you're choosing heart rate. I mean, I know it's going to drop your heart rate, but it's a non-selective beta blocker. What is he going to do? He's going to cause bronchoconstriction, and you're going to have airway issues. So if you see a question, they give the patient a beta blocker, and they say, what exams should you do? Listen to their lungs, because you can be constricting their beta. Remember, your lung has two lungs, so you have beta 2 receptors there, and your heart has beta 1 receptors. So if you give somebody non-selective beta blocker, it's going to block the heart and then block the lung. So, and I got the answer. Excellent. But the last one, it's not hyperglycemia. Okay, it's not. It's not hyperglycemia. You're almost there, right? It marks the hypoglycemic symptoms. So you don't give it to diabetes people. You got to be careful. So I call it maxed. Okay, it maxed the hypoglycemic. So if you diabetic and you're taking beta blocker and you are hypoglycemic, you won't be able to show the signs of hypoglycemia. A diabetic patient taking beta blocker need to be monitored. They may have to adjust their medication because beta blocker masks the effect of hypoglycemia. The effect of hypoglycemia is what? Tachycardia, right? Diaphoresis, right? All of them, if you take beta blocker, it will damp the effect of that. So beta blocker can damp the effect of symptoms of hypoglycemia. Therefore, if a patient who is diabetic is taking beta blocker, you have to worry about it. If we give a beta blocker to somebody, worry about bronchospasm if it's a non-selective beta blocker. Okay, so that's the teaching for you right there, right? Okay, I don't know if you noticed. This is a hard one. If you can see, I'm going to change it into, yeah, amantadine, right? You have to know the side effect of that. I can guide you, right? I can guide you. It has some anticholinergic effect, right? Some anticholinergic effect. It's a movement disorder. It can potentiate the effect of dopamine. At the same time, it has anticholinergic effect. So yes, it's used in Parkinson. One of the side effects of that, if you've never seen it before, apart from the anticholinergic, there's one specific side effect, right? We call it libido, right? Libido reticularis, right? That's the side effect. Libido reticularis. It's a skin manifestation. You can Google it and it will explain it to you. I mean, it's a skin manifestation due to spasm, and you can see it on your skin. And it's decreased blood flow and the spasm on your skin. You can see it look like network like symptoms. So that's what we use it for. So don't worry about it. That's one side effect you should know. How about this? This one everybody know about it. So we don't know what I'm typing. So INH. Two TB drugs, right? Two TB drugs. So what are the side effects of this medication? common side effect, like I said, the most common, right? And the priority that your body is going to ask you, the pumping and INH. And then that one. So I'll give you three. So 1, 2, 3. So yeah, the liver toxicity is the worst of all the symptoms. There is a common symptoms that you should know for each of them. So if your body is asking you, they're not going to ask you about the liver. Yes, they all causes liver problem. Yeah, urine discoloration is the rifampin. The most common is the urine, orange yellow secretion. So orange yellow secretions, whether your tears or saliva, vaginal fluid, anything like that. And isoniazid, I see somebody get it. Peripheral neuropathy. So peripheral neuropathy, right? Peripheral neuropathy. So those are good side effects. How about this? Phenoxin. How about that one? Right? I can help you. Not hypotension. No, I can help you. You can see that the patient should not eat pepperoni. No pepperoni. So what is that? So what is the side effect? Hypertensive agency. Excellent. So hypertensive agency. Excellent. That's the side effect that you got to worry about and teach the patient so that they can stay away from it as much as possible. Atorvastatin. I said, give me one side effect and this. Three medication. Atorvastatin, digoxin, or dancitron, right? I see rhabdomyolysis. Yeah, that's muscle pain, muscle cramps, rhabdo. Okay. And then how about digoxin? And then ondansetron. How about digoxin and ondansetron, right? Digoxin, yeah, Halo Vision, there's a bunch of them, I think cardiac toxicity is number one, you should worry about. But yeah, GI symptoms, you got to intervene. GI toxicity is priority function. I don't want to get all the side effects, but I'm looking for a GI symptoms. And that's my priority. I'm picking that one over cardiac because I won't wait until you have blurred vision. That means it's more toxic. I'm looking for GI symptoms, and then I will intervene. So GI symptoms is more important because if I wait when you have vision changes, you already had the GI symptoms. You start having GI symptoms before you start getting sick. You get renal issue. So this is the side effect of um, digoxin. If you draw the individual like that and you do a box and you draw them like a caricature, you can find the side effect. They have neuro side effect. They have vision problem, yellow changes, and then they have mouth, right? GI symptoms. Then their heart is here, cardiac toxicity. And then here there's a renal. But number one is GI symptoms. So this is my number one symptoms. Ondansetron, I think I saw the answer. Is QT prolongation. QT prolongation. Okay, so that's what you should worry about. That's the side effect I should worry about. How about this? The Frasidone. So the Frasidone is the same thing as ondansetron. That one too causes QT prolongation. QT prolongation. How about if I give you this? If I give you these three medications, and I said you have 25-year-old female taking this medication, what would you tell them? If you have to tell them one thing, tetracycline, rifampin, and phenytoin, advise her one thing about these three medications. If she's taking it, what are you going to tell her? One thing. If you have to tell her one thing, hey, you're taking tetracycline, you're taking rifampin, you're taking phenytoin, what one word? If I said talk to her, educate her. If the NCLEX give you this medication, it will be, and it's a selected apply, this will be one of the teachings you have to provide. So what teaching will you provide this patient? You can just say not to get pregnant. What are you going to tell her? Contraception. What kind of contraception? It's not enough. Not what kind of contraception. So you have to be specific. Yeah, I don't want you to get pregnant. Take contraception, but no. So what do you, I don't see the answer. There's one thing. No, contraception. Yeah, two discoloration. It's fine. We got it. But that's not a priority. Oral contraception. Barrier method. The oral contraception is ineffective. So your oral contraception does not work. Excellent. Somebody got it. Barrier contraception. Oral contraception are ineffective. So you want to teach her to take the husband have to wear condom. Somebody have to wear some barrier method to prevent getting pregnant because the contraception does not work. Okay, so that's the key thing you have to teach this patient. And then before I go, I want you to check my website, and then if you like it, if you need this is on demand. It's like how many lessons? Let me check. 131 lessons. I mean, yeah, it's very inclusive. Everything you need to know to pass your exams. I create quizzes as much as and some little bit of assessment. They're very hard questions. So try them out. It's found on adaptandclassreview.com. Good luck, best of luck, and bye.